Ozempic is currently all the craze. The word Ozempic will undoubtedly be mentioned on social media, in the headlines, or on broadcasts. It is a game-changing diabetic treatment and weight loss medicine that is difficult to get in the US. I am sure you have heard a lot about this drug as well. People frequently raise questions such as, is it safe? Does it work for weight loss? Will I regain the weight if I stop taking it? There is, in my opinion, a ton of information available, both good and bad, but what should we believe? So, in today's video, we'll go over a few things you absolutely must know about Ozempic. So without wasting time, let us get started. What is the Ozempic? The first thing you need to know is what the Ozempics are. As a result, the U.S. Food and Drug Administration, FDA, has approved the injectable medicine Ozempic for the management of type 2 diabetes. It belongs to a class of medications known as glucagon-like peptide-1 receptor agonists, GLP-1 RAs, which stimulate insulin production while inhibiting the liver's ability to produce glucose and aid in weight loss. How is Ozempic organized? Next, you must be familiar with how the Ozempic function. Ozempic's active component is semaglutide. It is categorized as a glucagon-like peptide-1 GLP-1 receptor activator and functions by activating GLP-1 receptors, which are responsible for controlling hunger and blood sugar levels. The weekly injectable Ozempic lowers blood sugar levels in diabetics by delaying digestion, boosting the manufacturing of the hormone insulin that lowers blood sugar, and reducing the liver's manufacture of glucose. Furthermore, Ozempic inhibits digestion and heightens feelings of satiety, both of which may aid in weight loss. Dosage and administration. Ozempic is injected subcutaneously once a week. The drug is convenient and simple to use because it comes in a pre-filled pen. It is crucial to adhere to your healthcare provider's directions for administration and dose. Advantages of Ozempic. There are several advantages to participating in the Olympics, so you should know that. Ozempic has several advantages for those with type 2 diabetes. It assists in weight loss, lowers blood sugar levels, lowers the risk of cardiovascular problems, and may lessen the need for further diabetes drugs. According to Pitta Kala, using Ozempic can reduce the risk of serious cardiovascular events like stroke or heart attack in persons with type 2 diabetes and heart disease. She also emphasizes the significance of maintaining a balanced diet and engaging in regular exercise for those taking the medication in order to gain the greatest benefit possible from it. The weight loss is an extra advantage of the Ozempics. Semaglutide slows down the process of your stomach emptying. Because your brain doesn't send you hunger signals when you take Ozempic, you won't feel as hungry, and because your digestion will take longer, you'll feel fuller for longer. Additionally, semaglutide has an impact on weight. It has been demonstrated to be more successful than many of the other weight loss drugs on the market. Potential negative consequences. Ozempic may cause negative effects, just like other medicine. The most frequent side effects of Ozempic include nausea, vomiting, diarrhea, and abdominal pain. Other side effects include hypoglycemia, low blood sugar levels. These negative effects are frequently minor and get better when the body gets used to the medication. Pancreatitis risk may rise with Ozempic use. Ozempic should not be restarted if this happens. It should be stopped. Additionally, there have been cases of renal injury in patients with GLP-1 receptor agonists, RA, such as Ozempic, which may necessitate hemodialysis. Any worries or lingering adverse effects must be brought up with your healthcare professional. Ozempic shouldn't be used by some people. You might not be eligible for Ozempic, even if you are obese or overweight, because not everyone should take this drug. Those who have a record of a particular form of thyroid cancer may not be suitable candidates for Ozempic. You must tell your doctor if there is a family history of thyroid cancer. All patients should be aware of the possibility of medullary thyroid malignancies before using Ozempic. Patients should continue to be monitored for thyroid tumor symptoms and get this advice from their healthcare practitioner. Additionally, anyone hoping to get pregnant should cease taking Ozempic well in advance of trying. Due to the long washout period needed for this medication, it is advised that women stop taking Ozempic at least 2 months before their anticipated pregnancy. Ozempic should not be used by anyone with a history of multiple endocrine neoplasia syndrome type 2 or kidney or pancreatic disease. When you stop taking Ozempic, what happens? If your goal is to lose weight while taking a semaglutide drug, Be aware that you can end up gaining weight if you discontinue the medicine. If you stop using these drugs, you're likely to see recidivism, warns Dr. Roslin. In one trial, participants who had been taking 2.4 milligrams of semaglutide per week for 68 weeks and receiving organized lifestyle interventions were terminated. Following 1 year, participants recovered 2/3 of their prior weight loss, which can be disheartening. Though they did gain weight again, it was less than it had been for individuals who had initially received a placebo. After a year without both the placebo or lifestyle therapies, participants in the placebo arm of the study, who received a placebo medicine along with organized lifestyle interventions, basically regained their previous weight. However, individuals who had taken the drug ended up 5.6% under their starting weight. Lifestyle factors. Although Ozempic can effectively control blood sugar levels, it's important to keep in mind that lifestyle changes, such as a good diet and frequent exercise, are vital for treating diabetes. For individualized advice, it is advised to speak with a medical expert or a licensed dietitian. Finally, remember that there may be interactions between Ozempic and several prescription drugs. Be sure to discuss any existing drugs with a reputable healthcare provider before beginning Ozempic. They will evaluate your medical history, perform a thorough evaluation, and advise you on the proper dosage, any possible side effects, and the anticipated results. What do you think about this if you are currently taking the Ozempics or are intending to take one? Tell us in the comments area, please. And if you like the video, make sure to subscribe to the channel for more informative content. See you in the next video. Till that, take care and goodbye.